Hello, I hope you've had a good week. I'm Dr. John Kruse, and today I'm going to be talking about comorbidity, ADHD, and Donald Trump. Some of this information is available in my book, Recognizing Adult ADHD. The format for today is similar to the past several weeks. I'll be talking for about 20 minutes. If you have questions while I'm talking, you can certainly type them in. I will try to answer them at the end of the time, and I'm prepared to be around for up to 20 minutes later. If you have questions or view this in a delayed time or after Friday morning, I'm happy to try to respond to any written comments at a later time. And next week's topic is going to be is whether Donald Trump's ADHD throws cold water on the Goldwater rule. And the Goldwater rule is the rule prohibiting psychiatrists from talking in public about a public official's mental health diagnosis. And I'll be arguing why that is fair and legitimate and even a good thing to be doing. But jumping back to comorbidity for today. So the term comorbidity is very simply just means having more than one condition at a time. So there's nothing more tricky or complicated to that simple word. Where it gets interesting is whether in situations where one condition increases the likelihood of having another, so that there's not just comorbidity, two things happening together, but a real association between the two. So I'll talk a little bit about comorbidity and ADHD in general, and then again, I'll move on to Donald Trump. And the angle that I'm talking about there is more specifically whether he could have other conditions that I and others are confusing for ADHD. So one big reason for comorbidity is a genetic reason. So 20, 30 years ago, the hope was we would find a gene for schizophrenia, a gene for ADHD, or maybe a handful of genes that greatly increase the likelihood for schizophrenia, depression, bipolar disorder, substance abuse, ADHD. We know that these conditions do have strong genetic components. I mean, separate from just running strongly in families, we can see from adoption studies where kids who don't have any genetics in common were adopted into a family, or kids were adopted out of a family. We know that there are strong genetic contributors to a whole host of mental health conditions, and ADHD is one of the ones with one of the strongest genetic contributions. So again, it's not just being raised in a family with other people with ADHD or having depression because you were raised among depressives. So one of the big findings, or maybe not even findings, is that rather than having a few simple genes greatly increasing the risk for any of these mental health disorders, we find that a huge number of tiny genetic contributions from a huge number of different genes. So each of these genes is adding way less than 1% to the increased risk of getting a disorder such as ADHD. So this is true within ADHD, it's true within depression, it's true within schizophrenia. And more interesting or more confusing is that many of these genes lead to an overall predisposition to any mental health condition. So part of why we see comorbidity is that there's a huge number of genes which are contributing to increasing your risk for ADHD and depression and schizophrenia and a whole host of other things. Again, each of them is only adding a tiny bit. And that doesn't mean that the genetic profile underlying schizophrenia is identical to ADHD or to depression or to other mental health conditions, but it's that the current categories which we have in mental health, which we've been using for decades in a formal sense and centuries in others, all of them share elements of, not an entirely similar genetic background, but a multitude of genetic forces predispose people to any one of these conditions, and most of the genetic contributors don't actually seem specific to one condition or another. So that's one reason for comorbidity. A second reason for comorbidity is that ADHD itself, which again is present early in life, which affects how someone is processing everything that's going into their brain, everything that's emitting from their brain in terms of behavior, actions, feelings. ADHD predisposes people to a number of different conditions. So we know that in the American population for years, substance abuse problems happen in about 15-20% of the general population. If you have ADHD, you have double the risk for that. Now with substance abuse, it's pretty easy to see why ADHD may contribute to this and strengthen the association, that if you are making decisions based on the moment, based on how a substance feels or what it does for you, that may make you more likely to choose or use and less aware of or less able to process long-term negative consequences of that. Certainly some of the biochemistry underlying ADHD with implications for dopaminergic disturbances are also shared in substance abuse disorders. So ADHD, clearly substance abuse is often comorbid with ADHD, not just for underlying genetic reasons, but also because ADHD contributes to developing a substance use disorder. ADHD also definitely increases your risk for developing an anxiety disorder. And a simple framing that is if you have thoughts bouncing around your head uncontrollably, then that itself can be an anxiety-evoking situation. Not being able to process your environment in a slowly logical time may lead you to being emotionally flooded and overwhelmed, and a source of anxiety as well. And the reasons for depression being overly present at greater extent than in the general population, in the ADD population, is that ADD leads you to going off track, leading you to lower financial success, job success, scholastic success compared to the general population without ADHD, having repeated, and again, you may or may not personally decide them as failures, but societally defined failures, having more dead ends, more failures, more losses, more disappointments, given your intellect and other talents and abilities, is a recipe for creating more depression. So getting back to why and I touched on this before, we make diagnoses for 3 different reasons. Again, the same reasons in psychiatry as in the rest of medicine. We make it to understand what's going on. We make them to be able to predict how that person may perform in future situations. And again, this is not predicting in the sense of claiming that Joe Biden's going to win the next election by 7.8%. This is predicting in terms of general probabilities that someone who has behaved this way in certain repeatedly over the past is extremely likely to behave this way in terms of certain situations in the future. And the third reason for making diagnoses is to provide appropriate treatment tailored to actually help the condition, and to highlight how not getting the diagnosis right can lead to misattribution and confusing things. I'm going to jump back to the last presidential election, and so much has happened in the last 4 years that most of us don't remember too much about what was going on then. But one of the most memorable events or things that was highlighted in the media was the second debate between Hillary Clinton and Donald Trump. That's a debate where he was wandering around or stalking her, left his podium, was in back of her, and many people, I read more than 24 different assessments, discussions, essays about this event. Absolutely everyone labeled this as, this is a case of Donald Trump trying to intimidate Hillary Clinton, and how sexist the behavior was, and how misogynistic it was, and how inappropriate it was. And while I'm not denying that there were sexist elements or misogynistic or narcissistic elements to it, I believe all those analyses are actually pretty much completely off track, and I'm using off track specifically. I think this was a perfect example of Donald Trump's ADHD. And why I say that is you actually look at what he was doing. He didn't march right over to her podium and use his height to impose his manliness or his superiority over her. I mean, if you want to see a beautiful example of that, when Hillary Clinton ran for Senate in the year 2000, Rick Lazio, who was a Republican opponent there, did exactly that. He marched right over, tried to intimidate her. She was able to talk him off and not intimidated. That was not what was going on here. If you again look at his trajectory, look at where he was going, when Donald Trump wants something, he does it simply and directly. If he wants to build a wall, he'll say, build a wall. He won't pussyfoot or meander around it. He will march right in. He was not marching right in. He was wandering all over the stage. That's an ADHD trait and not a example of trying to dominate someone else. Second piece of concrete evidence is that when the cameras flashed on him, winding up very close to and in back of her podium, you can look at the emotional expression on his face, and we have ways of objectively measuring emotional expressions. We know the look on his face when he was first caught that was surprise expression. If you are planning on marching over to someone else's podium and intimidating them, you are not going to be surprised. Now, it's conjecture as to why he was surprised. My conjecture is he wasn't paying attention because of his ADHD and he wound up there and he's caught on the cameras doing it. It's possible there was another explanation for why he was surprised, but the fact that he was surprised is not compatible with that. So again, getting to the importance of understanding what's going on at the mental health level, of making diagnoses that are accurate, it changes our whole interpretation of that event. So jumping back to Donald Trump and sort of the modern last 4 years and what's going on and whether another mental health diagnosis, because people have thrown out all these possibilities, could be really what's going on rather than his ADHD. So I'll start with depression. So depression very clearly can affect someone's attention. It can affect, they can miss more details, they can miss information, they can be shut down. However, the hallmarks of depression are mood that is pervasively either sad or numbed out or possibly irritable. Now, Trump is, frequently irritable, but the irritability is in direct response to situations. So it's not a pervasive irritability. If you give him happy news about supposedly positive data about COVID or some success on a political front from someone he's endorsed, he's happy. He's not still remaining gloomy. So he doesn't display any pervasive negative emotional state that would be consistent with the depressive diagnosis. Again, ADD and ADHD themselves increase the likelihood of developing depression, but that's not what's going on here. So again, second thing, anxiety. We know that anxiety disorders also can result in appearing inattentive, missing information, being distracted. Could he just have an anxiety disorder? And again, the prevailing state of an anxiety disorder is feeling anxious. And this is someone who boasts of his confidence, does display huge, excessive degrees of confidence to the point of arrogance. He doesn't appear afraid of too many conditions. Maybe, yes, he was hiding in a bunker to avoid crowds in the White House. So I'm not saying he has no fears, but an anxiety disorder cannot explain away the whole range of ADHD symptoms. So particularly an anxiety disorder would not explain Donald Trump's impulsivity, would not explain his hyperactivity. So his fidgeting, his twitching is not when he's particularly anxious or when he's talking about anything that may be anxiety evoking. That's a fairly constant state, which again, much more consistent with ADHD. So could Donald Trump have bipolar disorder? So there's a fair number of, so getting back to when I was talking about comorbidity, there are genetic reasons. ADHD is more often associated or found with certain other conditions. There are causative reasons that ADHD increases the likelihood of another reason. I didn't mention that there's a fake news reason. So the fake news reason for comorbidity is there are a number of conditions which are often confused or mistaken for ADHD. Now you can have both ADHD and bipolar disorder. Measurably, there is an association, so you are a little more likely to have bipolar disorder than the general population if you already have ADHD. You are more, and vice versa, you are more likely if you have bipolar disorder to have ADHD. You're more likely to have ADHD if you have bipolar disorder. The two are separable. You can have just one of those. But there's also a lot of people going on out there who are mistakenly diagnosed and told they have bipolar disorder when they really have ADHD. And part of what's different between the two is ADHD is a pervasive state. It may be displayed differently in different environmental situations, but over time, day to day, week to week, it's ongoing, it's present and there. By definition, bipolar disorder, you have episodes of depression, you have episodes of mania or hypomania, and you have episodes when you're not in either state. So I'm going to race through these conditions. So another condition that overlaps or can appear as ADHD and it is PTSD. And the simple answer is why we can be sure PTSD does not explain Donald Trump's pattern of inattention, impulsivity. Maybe some of his responses really are hyper-startle. It doesn't seem to be that way. But nobody has identified any significant traumatic event that in his life that would lead him to having PTSD. And that's not saying he had an idyllic childhood, but he didn't have major life-threatening trauma going on. So could dementia explain Donald Trump's presentations? There's certainly been some objective research into it, looking at his choice of words and how there's been a decrement over time in the lexical complexity of how he expresses himself. I cannot rule out that there's some element of dementia going on that's overlapping with ADHD, and both dementia and ADHD at their core have a decrement or a deficit in certain executive functions in terms of organizing thoughts, in terms of suppressing responses. The big issue, though, is that dementia, by definition, is a decrement from your baseline, usually towards the end decades of life, whereas ADHD is a neurodevelopmental process. We know Trump has displayed some elements of this ADD-ness since early childhood. That part of it cannot be purely dementia. We can also rule out that he doesn't have traumatic brain injury because there aren't any other. I mean, again, recently people have talked about how he has had trouble shaking when he's holding up a Bible, tripping when he's going down steps. There may be, in the last few months or years, some neurologic issues going on, but he isn't showing focal specific neurologic problems that would help us explain the range of ADD symptoms as being merely a sign of a traumatic brain injury. Certainly drug use, and particularly stimulant medication use itself or abuse in people who don't have ADHD, they can look like an ADHD picture. I mean, they can be talking rapidly, they can be inattentive, they can be distracted, they can be impulsive. We don't have any documentation that Donald Trump that his alcohol abuse or other drugs are causing his problems. And again, I will get to this in a future talk, but we have actually fairly compelling evidence that there are times he is almost certainly using stimulant medications, and those are the times he's actually less hyperactive, less fidgety, that he is less incoherent in his speech patterns, that he is able to follow one thought with another more logically and consistently. So drug use in Donald Trump suggests that he actually should be doing more of it, not less of it, and that is not a source of his ADD-like problems. And I also talked last time a little bit about personality disorders. What I didn't focus or say then, we actually know that having ADHD in childhood predisposes you or increases the risk for narcissistic personality disorder, antisocial, and borderline personality disorders. There are also elements of all of those that can be confused with ADHD. So again, someone with ADHD may not be focusing as well on the world around them, may be inattentive towards them, but that when we try to make careful diagnoses, we should be differentiating whether the person is oblivious and not really aware of it's not reaching their cognitive consciousness, or whether they are aware and deciding to dismiss, diminish, devalue those people or others around them. So this has been a huge amount of information mushed together in this talk on ADHD and comorbidity. Again, I am happy to answer any questions. I'm not seeing any now, so if nothing shows up in the next minute, I will sign off for today. So again, much of this information is available in Recognizing Adult ADHD. That's available on Amazon, Barnes & Noble, and independent bookstores. It's available as an audiobook and a digital book as well. There's also numerous, up to 50 plus articles I've written on this on medium.com under John Kruse. And since I'm not seeing any questions, I'm going to be signing off for this week. Next week, I'll be talking on does Donald Trump's ADHD throw cold water on the Goldwater rule. Have a healthy and happy week. And that's all for now.